Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. We have a very special segment. This segment has to do with something that's afflicting many of us in our country. One, diabetes. And unfortunately, in my Latin American community, very high incidence of diabetes. And secondly, periodontal disease, gum disease, losing your smile, losing your confidence, very prevalent in our country. And so tonight we're going to start on a first of two videos on some very important correlations that we will be sharing, and we'll be starting with that tonight. And engineer, if you can put up the slides on the screen, we will begin with our presentation on periodontal gum disease, inflammation, and diabetes. There you go. Something really important to realize is that approximately half of the American population suffers from gum disease. Unbelievable number of Americans, about 160 million. So there you see on the lower screen what happens, the unsightly recession. You see the woman pointing to very red gums, very inflamed and painful, sore. Let's look at some statistics from the Center for Disease Control. And that's that 1 of every 2 Americans aged 30 and over has some form of periodontal disease. And 65 and older, the prevalence rates increase 70%. 7 of 10 Americans having periodontal disease. 160 million Americans have some form of mild, moderate, or severe periodontitis. And when we start delving now into the correlations between gum disease and blood sugar, diabetes, you will start seeing some very important situations that we need to take a look at. And so engineer, if you can, for some reason, I'm not able to advance the slide. So if you can, if you give me the next slide on the presentation. There we go. So we need to see what are the warning signs of periodontal disease. Bad breath or bad taste in your mouth, something that a lot of my patients complain about. Swollen, inflamed, red gum tissues. Tenderness of the gum, sensitivity. Bleeding when you brush, when you floss, maybe when you eat an apple. and pain upon chewing. So here you see the example of the inflamed gum between those incisors, the redness. And here on the x-ray, there's a blackening that occurs between the teeth. Why? Because that person is losing their bone support. Their teeth are going to become loose. The gums are going to recede from the bone loss. They're going to become sensitive. And there you see the disease process highlighted. And there the bone loss in that black area that I was noting to you. So, as I mentioned, the loosening of the teeth, the sensitivity increasing, the fact that the gums are receding. Sometimes you may notice that your teeth just don't feel the same way anymore, and or that your dentures don't seem stable, or there's some movement. And these are all things that we can notice. Here you see a clinical picture of an actual case. And really, aside from all the things we mentioned, is also the lack of confidence, the fact that you're just not comfortable. And, you know, when you have a situation that, like we have on the screen, is something that no one wants. No one wants their teeth to get this way, and it's totally preventable. So what are these risk factors that we can avoid to try and prevent the periodontal disease? One is smoking. There's 2 to 3 times more gum disease with smoking. The other is diabetes. To have a good control of your blood sugar if you have diabetes, hopefully preventing diabetes to begin with. Your hygiene habits. Do you floss every night? Your stress levels, because stress is related to disease, and it's related to not only diabetes, but periodontal disease. Your genetics or heredity, whether you have crooked teeth, if you have an underlying immune deficiency, or maybe you have a rheumatoid arthritis or taking different medications, or maybe a antihypertensive medication for your high blood pressure, your hypertension. These all modify and exacerbate and make worse periodontal disease. Fillings that need replacement harbor bacteria. Bridges that no longer fit properly harbor bacteria. And for those women watching the show, unfortunately, hormonal changes or birth control pills, which cause hormonal changes, all leading to periodontal disease. So let's take a look. And there on the left, you see the periodontal disease. You see the black tartar accumulating on the tooth. The gums becoming red. And this is all exacerbated and made worse by the lower pictures of obesity and smoking. And what happens is you get bone loss around the teeth. There you see this tremendous crater around that molar tooth. This person is going to end up losing that tooth and needing a dental implant. And this was actually published in Time magazine under the title, The Silent Killer. Why? Because all these things cause inflammation. And periodontal disease inflammation is something that's going to be linked to systemic overall disease states. Here you see chronic infection of the gum. This is a diagram showing the blackish, brownish tartar, or what we call calculus, calcium deposits that harbor more bacteria. And on the root of the tooth, accretions. There you see them highlighted. And then what happens is they cause inflammation and ulceration of the gum tissue that you see there highlighted. So let's talk about the association with periodontal disease and diabetes, because diabetes affects approximately 34 million Americans, more than 60 million adults currently at increased risk for developing diabetes. And evidence suggests that diabetes is associated with gum disease, periodontal disease. So obviously, if we have 50% of the population suffering from periodontal disease, then that number, 34 million Americans, is going to be going up, and you would be more predisposed to having periodontal problems which when again in a catch-22, worsen your diabetes control. Inflammation from the periodontal disease has been shown that it affects the diabetic state and other components of diseases and of diabetes. Research suggests that the infectious inflammatory gum disease adversely affects your control of your diabetes. So you may feel, well, I'm doing everything I can with my diet, but somehow I'm not under control. Well, that's because of the problem that the periodontal disease is not under control. And it, by causing inflammation, is affecting your diabetic control. So it's very important that we treat the gum disease and reduce the inflammation to have a positive effect on what's going on in your mouth. It's a two-way street. So the periodontal disease and the diabetes interacting. This has already been shown. Many studies, many different scientific journals, and it's something that I work as a periodontal surgeon in collaboration with physicians and with the treating dentists so that we control and help you not only have a healthy mouth, but a healthy body and long life, and enjoy your foods and enjoy your energy level. So let's take a look a little bit more at how diabetes is affecting you. So diabetes causes a thickening of the blood vessels. So what does that do? That causes a decrease in your flow of nutrients into your tissues. It causes, a reduction in the blood flow into the tissues. And when you have that, then you're going to have a greater risk of infection because the body's normal inflammatory response against infection is retarded, is reduced. And your waste products increase in the periphery. Periodontal disease being in the periphery, since it's up in the head, away from the center of the body. So what happens is now those waste products form toxic compounds which affect your mouth, your bone levels. Diabetes leads to higher blood sugar, and these high blood sugars end up not only in the bloodstream, but in the oral cavity where they can lead to tooth decay. And this promotes the growth of bacteria. Obviously, it's like giving them a 4-course dinner, and they're very happy to live and increase their population around your teeth. So another factor is smoking. And as we mentioned already, that smoking can increase periodontal disease 2 to 3-fold. But even more importantly is that a person who has diabetes and now smokes is at a much greater risk than a person who didn't smoke and had their diabetes under control. And these diabetic-related factors, together with having a poor oral hygiene, not flossing, not really brushing the way we all know we should, all these lead to periodontal disease. Here's a study of periodontal gum disease and insulin resistance and high blood sugar and high cholesterol and weight gain. And most of us complaining, I want to lose weight. Well, very interesting now, because we see that the periodontal disease, by affecting the diabetic control, and now you gain weight. You can't lose the weight that you're going to the gym to do, or your energy level is lower. Your blood sugar stays high, and you're wondering, well, my cholesterol, I've got to worry about my cholesterol because of my heart, my family history. Well, all of these things come under insulin resistance, which is a chronic, low-level inflammatory condition, and it's closely related to the high blood sugar and the high cholesterol levels, the high triglycerides, and the obesity. So you see how all these things are coming together, and they're coming from inflammation. And these inflammatory factors, which are released in periodontal disease, worsen this insulin resistance, which is leading to the high blood sugar, to the obesity, to the high cholesterol levels, your low energy levels, your bad taste, your receding gums, all complicated compounds together, and so many different factors that are causing problems that maybe you never realized. Let's go on. So what can you do? What are some things that you can do so you can control the periodontal disease, so you can control your inflammation, so you don't adversely affect your diabetes? Well, one, very simple, is get and keep the visits you make with your dentist, with your physician, because now you're starting to realize, oh, the diabetes can affect my mouth. Yes. Oh, my gum disease can affect my diabetes. Yes. So keep those visits. If you're diabetic, follow your physician's recommendations. Control your blood sugar. Don't use tobacco. Don't vape. Don't use smokeless tobacco. If you wear dentures, make sure you clean them and take them out at night. Let your mouth have a chance to rehabilitate and breathe at nighttime. Eat a healthy diet. Fruit, vegetables. Avoid sugars. Avoid pastries. Avoid too many desserts. Who doesn't like a really tasty dessert? But is it worth that in terms of your health? Eat it in moderation. Control it. Now, in terms of your oral hygiene, try to brush twice a day, morning and night after you've eaten. And at nighttime, floss. Some people say, well, should I use the wax floss, the non-wax floss? All the studies show it makes no difference. My recommendation, so you have an easy time of it and it doesn't rip between your teeth, get the wax floss, get the mint flavor. None of these things are going to harm you. When you brush, use small circular motions. If you've forgotten, look online or visit your dentist, or if you're one of my patients, we'll show you. We're always showing patients. But you want to brush gently with a soft toothbrush, nylon bristles at the gum line, and then sweep up after your small circular motions to remove the plaque on all the surfaces, not just the outside, but the inside, the biting surface, and behind the back teeth. So brush your tongue when you brush your teeth. As I said, floss at night, and don't saw back and forth. Because if you saw back and forth, instead of curving around the tooth and going gently up and down, you're going to damage your gum lines and defeat the whole purpose of what you were doing. Now, let's say, unfortunately, you've gotten beyond that and you now need treatment. So basically, the treatment is targeted to remove the bacteria, which in dentistry we call plaque, and the tartar that forms from those bacteria that in dentistry we call calculus. So those germs or bacteria, which we call plaque, form into tartar, calculus, calcium deposits, like little tiny stones below the gum line, around the gum line. And this is why it's important for you to have routine cleanings. I recommend as a periodontist every 3 months. Your insurance won't cover it, but even though your insurance won't cover it, it's important that we actually control what's going on in your mouth. Is it really worth a little bit of expense to end up having tooth loss, needing gum surgery? I don't think so. So I tend to recommend 3 months, but at least try to do every 6 months. And when you do, go in for those cleanings. Make sure that you're shown how to brush properly, how to floss properly. Sometimes the disease goes a little bit further. With COVID, many of us didn't get a chance to visit the dentist as regularly as possible. So then at that point, you may need something a little more than a simple cleaning, which on the screen you see is called scaling and root planing. Scaling and root planing is a little more profound cleaning, a little deeper cleaning, to get those deposits that have gotten below the gum line into what are called pockets. They're spaces down into the gum line where these bacteria grow, form more tartar, and start destroying your bone. So we want to get those out with deep cleaning called scaling and root planing. Sometimes I prescribe, along with the scaling and root planing or the deep cleaning, an antibiotic. Sometimes I prescribe a special rinse, because that rinse will help the bacteria to be dissipated, help the body to heal, and the gums to turn from red and swollen into pink, firm, and healthy, with a pleasant feeling in the mouth, with no bad taste. Now, sometimes, unfortunately, you've let it go too far, but the good news is there's a lot we can do. So you may require a little more treatment, surgical treatment, or laser surgical treatment, because I do both in the office. But the main point is it's really not a horrific thing. It's done with local Novocaine. You can continue your daily work routine. And what the whole purpose is to get below the gum line into areas that we just can't get otherwise. And we clean out those tartar deposits, which if we leave there are going to destroy your bone. And we get them out and we irrigate the area, the body can breathe again. And then at that point, we take a look. Sometimes we put in some bone powder to heal the bone. Sometimes that bone powder is mixed with a special gel, which helps to regrow your bone and gum tissues. And then we put those things to work to help you to heal and have a healthy mouth that we can now maintain in 3-month cleanings. So let's take a look at something very important to get out of this segment tonight. So we talked about gum disease, we talked about inflammation, we talked about diabetes. And there's a tremendous amount of data, again, to make sure that this point is not missed, that inflammation leads to periodontal disease, leads to rheumatoid arthritis, leads to diabetes, to Alzheimer's, to atherosclerotic heart disease, to obesity, to so many different diseases, to gastric upsets, stomach upsets. And so we want to really control inflammation. And as I said at the outset, this was actually published in Time magazine as the silent killer. Why? Well, because periodontal disease, gum disease, doesn't hurt. Diabetes doesn't really hurt. It's only when it becomes more advanced that you start noticing the changes and the symptoms of gum disease. But by then it's very advanced. Likewise with diabetes. So here I want to show you some good news. That was published in a major journal, the Journal of Periodontology, all across the country, to all dentists and periodontal specialists, that with treatment, we actually were able to decrease the levels of inflammation, not just in the mouth, but in the whole body. And by doing so, reduced inflammatory factors in the body, in the bloodstream, which are correlated with all the diseases that we just listed, and more importantly on this show, with diabetes, which is afflicting so many Americans in our country. So here are some instances of what I've encountered in my office. All of this could have been prevented. When you look at that upper left picture, with tremendous inflammation, you see that that person is not comfortable. That person has a darkening of the teeth. You can rest assured that they're probably very self-conscious, because when they speak, they felt that they have a bad taste. They've tried to use a rinse or a mouthwash. They try to maybe chew on gum. Maybe they have mints. But it only is a temporary fix, because what they have is growing without oxygen underneath their gums. And you can see what's happening in that person. That bad odor, that bleeding is something not to ignore. But the point is not to let it get that way to begin with, and not to really have your life dictated only by what your insurance will pay. You know, sometimes I make jokes about that, because sometimes we do the craziest of things and we make decisions really that are not logical, and later on we say, well, gosh, if I would have known, I would have done so and so, and I would have gotten that treatment done, and now I'm spending so much more time, so much more money. My insurance is still not covering it, but it's much worse. I have no choice. I'm in pain. I'm self-conscious. I can't eat properly. My wife is yelling at me, or if it's your wife, your husband, you know, is telling you that, you know, your breath is not the way it should be. And so, not things that you want to go through. On the lower right, you see another case, a little milder, but if you start noticing this, that you have inflammation, that you have a little bit of redness around the gum line, that you're starting to feel a little sensitivity when you eat sweet, when you eat cold, maybe when you have hot. You know, these are all signs of a form of periodontal disease, or it could actually be dental decay. And remember, dental decay untreated gets very large. You may end up needing root canal treatment. Unfortunately, sometimes the decay goes so far, you see your dentist, but they end up sending you to me because there's so much decay. The tooth is not able to be restored. We can't repair it. Now the tooth has to be removed. You need a dental implant, and this all could have been prevented. So I really hope that this has been informative to you, and the importance of controlling your gum disease and its interaction with your diabetes. And if you're having problems with your diabetes, realize that you should probably visit your dentist or visit your periodontist. Come see us, because you probably have a gum problem. It's probably undiagnosed. 50% of Americans have some form of gum disease, and that gum disease is correlated with diabetes. Don't let that affect you. Don't let it lead to heart disease and possible further problems. It's been my pleasure to be with you, and may you have a happy, healthy smile, beautiful teeth, have your confidence return. If you need to see us, there you see our phone number, our email on the screen. We'd be happy to see you, or visit your dentist and start your way to a happier life and a big smile. And the next time I see you on Time for Truth, until then, it's been a pleasure. Have a good day.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet